This presentation is a part of our lecture on the chapter on the practical antimicrobial therapy. So part of your knowledge on the antimicrobial therapy in animals is your awareness about the antimicrobial resistance. So this presentation has been prepared by the Australian Commission on Safety and Quality in Healthcare for use during the Antimicrobial Awareness Week. So the Antimicrobial Awareness Week is celebrated every 18th and 24th of November. Antibiotics are one type of antimicrobial agent. Antibiotics are medicines used to treat infections caused by bacteria. Most importantly, antibiotics will have no impact on treating infections caused by viruses. The term antimicrobial refers to a substance that inhibits or destroys bacteria, parasites, viruses, or fungi. The term antimicrobial also refers to medicines used to treat or prevent infections caused by bacteria, parasites, viruses, or fungi. Antimicrobial fall into four categories. We have the antibacterials or antibiotics. We also have the antivirals. We also have the antiparasitics and the antifungal drugs. Antibiotics are a type of antimicrobial. It is used when bacterial microbes are harmful to human health. It is also used to treat bacterial infections by targeting bacteria. They do not cause harm to human cells or work on viruses. They can also cause side effects, drug interactions, allergies, and damage the good bacteria that we carry and need. So when we say antibiotic, that is a compound that inhibits the growth or kills the bacteria. So in recent years, antibiotic has become synonymous with antibacterial. So when we say antibacterial, that is a drug, chemical, or other substance that kills bacteria. So that substance is bactericidal or stops their growth, bacteriostatic. Antimicrobial is again defined as a drug, chemical, or other substances that kills and activates or slows the growth of microbes, including bacteria, viruses, fungi, and parasites. So all of this, the antivirals, the antifungals, and the antiparasitics are considered to be antimicrobials. This presentation has been designed to be a resource used to explain antimicrobial resistance and the relationship to antibiotic use. It is designed for organizations to customize as they like. It will highlight the increased chance of resistant bacteria spreading readily between people in the community, as well as in the primary care services, hospitals, and aged care homes. It will also outline the significant effect that antimicrobial resistance has on the community, individual patients, health services, and the health system more broadly. Content covered in these presentations include the link between antibiotic use and the development of antimicrobial resistance, the importance of appropriate antibiotic use as one strategy to contain and control antimicrobials, the action being undertaken globally to prevent, monitor, and reduce antimicrobial resistance, and the role of antimicrobial stewardship programs play in supporting the appropriate use of antibiotics. The Antimicrobial Awareness Week aims to encourage appropriate prescribing and responsible use of antibiotics in all healthcare settings. It has been a major recurring global event since 2015, but has been in existence for some time before then. AAW focuses on building awareness of what is antimicrobial resistance, how antimicrobial resistance occurs, the health impacts resulting from resistant bacterial infections, actions that can be taken to reduce antimicrobial resistance, and the resources available for clinicians and consumers. Antibiotics have a spectrum of activity. Some antibiotics can treat one or a few species of bacteria and not others. For example, they might treat gram-positive organisms and not treat any gram-negative organisms or vice versa. These are known as narrow-spectrum antibiotics. Antibiotics that kill or inhibit many species of bacteria or cover multiple classes and such as gram-positive and gram-negative bacteria, or cover multiple aerobic, anaerobic, and atypical bacteria, are known as broad-spectrum antibiotics. because you want to only target the bacteria causing the infection and not kill the good bacteria or cause other bacteria not causing the infection to acquire resistance genes. It is important to use narrow spectrum antibiotics wherever possible. Dealing with antimicrobial resistance developed the PAL, or the Priority Antibacterial List for Antimicrobial Resistance Containment, or PAL. This aims to promote improved prescribing by reducing the total quantity of antibacterial used. With the use of antimicrobials that are implicated in AMR, certain antibiotics are restricted or contained to limit their use. So there are two main categories making up this list. We have the access and the review classification. And for the review classification, we have the curb and the contain segment. So for the curb category, this curb category includes therapies recommended as first-line agents for common bacterial infections, despite a high AMR potential. This category also includes agents not recommended for first-line treatment but with moderate AMR or healthcare-associated infection (HAI) potential. We also have the contain category, and this includes the agents with high AMR or HAI potential that are not recommended as first-line agents for common bacterial infections. So these are the antibiotics under the review contain and the review curve categories. Is antimicrobial resistance, or AMR? AMR is one of the most significant challenges for the provision of safe, health quality, or high quality health services across the world. It occurs when bacteria, parasites, viruses, or fungi change to protect themselves from the effects of antimicrobial drugs designed to destroy them. The term antimicrobial resistance also refers to the failure of an antimicrobial to inhibit or destroy bacteria, parasites, viruses, or fungi for which it has been designed using standard dosing regimens. AMR has a direct effect on patient care and creates a set of critical ongoing challenges to health service delivery. It can increase the patient's length of hospital stay and severity of patient illness. Severe infections caused by bacteria that do not respond to available last-line antimicrobials can result in septicemia and death. It can also increase the complexity of treatment and places a significant burden on patients, health service organizations, and the health system. The World Health Organization has identified AMR as one of the biggest threats to global health. According to Amina Mohammed, Deputy Secretary General of the UN, she was quoted as saying that antimicrobial resistance is one of the most pressing issues globally, not only for human health, but it is a multi-sectoral problem involving animal health, agriculture, the environment, trade, and many other sectors. Are antibiotics and antimicrobial resistance important? Consumers are aware that antibiotics treat infections. However, consumers may not be aware that antibiotics are essential in preventing infection after surgical procedures and for patients receiving chemotherapy. Antimicrobial resistance has a significant and direct implications on patient care. Antibiotics play an essential role in preventing infection after surgery. For example, people currently undergoing surgery procedures receive standard prophylactic antibiotics and currently experience infection rates of around 0.5 to 2%. If access to effective antibiotics were reduced through antimicrobial resistance, post-operative infection rates could rise to around 40 to 50%, and up to 30% of these patients could die from these infections. Antimicrobial resistance also impacts on a range of treatment options, such as chemotherapy for cancer patients, which may no longer be a viable or safe option due to the risk of complications and infections resulting for poor post-treatment. This reduction in safe and viable treatments and services able to be offered by health facilities would have a negative effect on the effectiveness of the health care system in the long term. It is reported that bacteria resistant to current antibiotics cause more than 750,000 deaths worldwide every year. This includes 230,000 deaths from multi-drug resistant tuberculosis. Without any action to stop the spread of resistance, it is predicted that this number will rise to 10 million deaths per year by the year 2050. The economic burden from increasing resistance is estimated to cost about 100 trillion US dollars globally by 2050. Important to note that the use of antibiotics has an impact not just for the patient using them, but the global community as well. Of course, for the individual using the antibiotic, it has some benefits because it provides immediate effectiveness or relief of the antibiotic against the disease. For other patients, the development of antibiotic resistance from one patient can be transmitted also to the other patient. And we also have the development of antibiotic resistant infections when we are, for example, using antibiotics for a longer period of time. In terms of the community, AMR can also result to reduce antibiotic effectiveness, and also, of course, when we are using treatment or antibiotics or antimicrobials that are not effective, so it can result to a higher healthcare cost. How has antimicrobial resistance developed? AMR occurs when bacteria develop resistance to an antimicrobial that was previously an effective treatment. Bacteria develop natural defenses against antibiotics. When this occurs, potentially due to prolonged exposure to or overuse of a particular antibiotic, the antibiotic's effectiveness to treat the infection decreases and may reach a point where the antibiotic has no benefit. The overuse of antibiotics in health, both human and animal, and agriculture has increased the amount of exposure bacteria have to them, giving bacteria more opportunity to develop resistance. The process of natural selection fuels the increasing prevalence of antimicrobial resistance. New challenges in infection control resulting from more complex healthcare and increasing domestic and international travel have increased the spread of resistant bacteria both between individuals and between countries. When patients have longer hospital stays, this may increase the chance of patients acquiring resistant organisms from other patients. This diagram shows the examples of how antibiotic resistance spreads. So there are many vectors whereby the antibiotic resistance will spread to different segments of the ecosystem. So we'll start with the spread in human patients or humans. So in this case, we have a patient, no George, getting antibiotics. So when there is misuse or overuse of a particular antibiotic, so the person can develop resistant bacteria in its gut. So George will get care at the hospital, nursing home, or other inpatient care facility. When, for example, in treating a particular disease that can be caused by AMR. So resistant germs spread directly to other patients or indirectly on unclean hands of healthcare providers. So when George stays for a longer period of time in hospital, so he can transmit the resistant germs to other patients. Resistant bacteria can also spread to other patients from surfaces within the healthcare facility. So when patients will go home, so they can spread the resistant bacteria uh, to their to the other people in their homes, developing a vicious cycle. We also have in animals, so in the case of animals, the animals get antibiotics and develop resistant bacteria in their guts. Of course, that is from the misuse or the overuse of antibiotics. So the drug-resistant bacteria can remain on meat from animals, and when not handled or cooked properly, the bacteria can spread to humans. So it can also spread, from, of course, animals, food-producing animals being exposed to or being consumed by humans. We also have here the fertilizer or water containing animal feces. So from the animal themselves, so we have the transmission is via the feces or water contaminated with the the fertilizer or water or contaminated, with the animal feces, as well as drug-resistant bacteria that is used on food crops. So the drug-resistant bacteria in the animal feces can remain on crops and be eaten by, for example, humans. This bacteria can remain in the human gut. So the humans, as the consuming public, can develop antibiotic resistance via, by the environment. When, for example, the food, coming from animals or the crops have been contaminated with resistant, drug-resistant bacteria. They can also directly consume that from meat that have been, infected with drug-resistant bacteria. The same is true for humans. So there is also a vicious cycle of the transmission of the drug-resistant bacteria because it can also spread, for example, in healthcare facilities, and these resistant bacteria can spread to other patients, and these patients can also spread that when, of course, they go home, they can spread that to their family, also, or in the community as a whole in general. Addressing the rising threat of AMR requires a holistic and multi-sectoral approach that is referred to as One Health, because antimicrobials used to treat various infectious diseases in animals may be the same or similar to those used for humans. Resistant bacteria arising in humans, animals, or the environment may spread from one to the other and from one country to another. AMR does not recognize geographic or human-animal borders. So this diagram shows the total antibiotic consumption by setting expressed as DDDs per 1,000 inhabitants per day in Europe, no, particularly in England. So this part here, represents the antibiotic use in the general practice. We also have here, the hospital inpatient, the other community, and the hospital outpatient. So we also have here, the usage of antibiotics, particularly in humans, of course, that is in the community itself and the hospital. For animals, we use antibiotics for pets and, of course, for livestock. And for the agriculture, we use that for crops and aquaculture. In terms of the usage, of the antibiotics in the different segments of the population in the US. So majority of the antibiotics are being utilized in the livestock industry, followed by humans. We also have the aquaculture, the pets, and the crops. So antibiotic resistance is considered to be not new. In an interview shortly after winning the Nobel Prize in the year 1945, for discovering penicillin, Alexander Fleming said, "The thoughtless person playing with penicillin treatment is morally responsive for the death of the man who succumbs to infection with a penicillin-resistant organism." So some resistance is getting worse through time. This graph shows the carbapenemase producing Enterobacteriaceae, CPE, becoming more resistant or more prevalent in Europe over a short period of time, that is from 2013 to 2018. So the Enterobacteriaceae, has been renamed as Enterobacterales. Um, so in this diagram, so some antimicrobial resistance is getting worse in the sense that, for example, in the case of the carbapenem resistant Enterobacteriaceae, now as you can notice here in 2013, this is the endemicity or the prevalence of the resistant bacteria in Europe, no, in the year 2013, and we also have here the comparison in the year 2018. So from the color-coded regions there represents the severity, no, of the prevalence of the carbapenem-resistant bacteria. So from green to dark red. So the dark red here represents an endemic situation, and the green there represents a no case reported. Then we have here, you know, a sporadic single hospital outbreak, sporadic hospital outbreak, regional spread, and the interregional spread. So as you can notice here, from 2013, so from this area here of Europe, you can notice here that there is an increase in the severity or increase in the prevalence of the carbapenem resistant Enterobacteriaceae. So this only means that through time there is an increase, in the prevalence of some bacteria that are resistant to antibiotics. Microbial use is a key factor in the development of antimicrobial resistance. The more antimicrobials are used, the more likely it is that resistance will develop. In this diagram, you have here the relationship, between the total antibiotic consumption. You have here that is represented in the x-axis, and the Streptococcus pneumoniae resistance to penicillin, shown, in the y-axis, and this is measured in 20 industrialized countries. So what is Streptococcus pneumoniae? Streptococcus pneumoniae causes otitis media, sinusitis, acute exacerbation of chronic obstructive pulmonary disease, pneumonia, meningitis, and septicemia. This slide shows that the occurrence of penicillin non-susceptible Streptococcus pneumoniae plotted against the outpatient use of penicillin in 20 industrialized countries. It is a representation which clearly demonstrates the relationship of antibiotic usage. This is the antibiotic usage with the development of penicillin resistance. As antibiotic usage is increased, so is resistance. So when we are going to increase, the antibiotic usage in the population, so there is also an increase in the development of penicillin resistance, as shown in the diagram. So this is again measured in 20 different industrialized countries in Europe. So why can't new antibiotics be developed to tackle resistance? Well, they can, but there are reasons why this is a very slow and complex process. Many pharmaceutical companies have stopped developing antibiotics over the last 20 years, resulting in a very few antibiotics being developed and released onto the market. The reason for this decline is that antibiotics, in particular, are extremely expensive and resource intensive to develop. The World Health Organization reviewed the publicly available information on the um, current clinical development pipeline of antimicrobial agents. The review showed the current clinical pipeline is still insufficient to mitigate the threat of antimicrobial resistance, particularly that of gram-negative bacteria and TB. And most agents are in the pipeline are modifications of existing antibiotic classes. Therefore, they are only short-term solutions as they usually cannot overcome multiple existing resistance mechanisms. Pharmaceutical companies that have released new antibiotics recently have had poor return on investment from them. There is much more incentive to develop the next cholesterol-lowering medication that a patient will take once a day for the rest of their lives, rather than an antibiotic that the patient will only use for a short period of time and that bacteria will inevitably develop resistance to. This is reflected in the figure of this slide, comparing the sales of recently launched antibiotics to medications for metabolic disorders, such as Januvia, which is for type 2 diabetes. Antimicrobial resistance threatens the foundations of modern medicine. Coordinated and immediate action on the global scale is required to respond to the increasing occurrence of infections resistant to the last-line antibiotics. In May 2015, the World Health Assembly adopted a global action plan on antimicrobial resistance, which outlines 5 key objectives. The first objective of this is improve awareness and understanding of antimicrobial resistance through effective communication, education, and training. Second, strengthen the knowledge and evidence base through surveillance and research. Third, reduce the incidence of infection through effective sanitation, hygiene, and infection preventive measures. Fourth, optimize the use of antimicrobial medicines in human and animal health. And fifth, develop the economic case for sustainable investment that takes account of the needs of all countries and to increase investment in new medicines, diagnostic tools, vaccines, and other interventions. With a coordinated global approach, the goals of reducing and preventing infections resistant to the last line of available antimicrobials and the ongoing delivery of safe healthcare with quality assured and effective medicines is achievable. Infections caused by resistant bacteria may need to be treated with stronger antibiotics, which can have severe side effects, be more expensive, and take longer to work. In the most severe cases of antimicrobial resistance, resistant bacteria may not be able to be treated by any currently available antibiotic. Antimicrobial resistance can also result in significant cost to society with the loss of productivity and reduced workforce capacity. Critical antimicrobial resistances or CARs are defined as resistance mechanisms or profiles known to be serious threat to the last line antimicrobial agents. The most prominent examples of critical resistance are Enterobacteriaceae, harboring carbapinemases, and vancomycin non-susceptible Staphylococcus aureus. We also have an additional list that is added in October 2018, and there are recommended 4 new CARs. These are the Candida auris, Enterobacterales harboring MCR genes, Acinetobacter species harboring carbapinemases, and the Pseudomonas aeruginosa. There are different measures to how we use antimicrobials. Utilization shows the volume of antimicrobials we are using, but it doesn't show how well they are being used. For example, a hospital specializing in oncology would use more antibiotic per population than a hospital specializing in rehabilitation. Using raw consumption figures may suggest that the high use and broader spectrum used in the oncology unit is wrong. On the other hand, knowing that 90% of the patients got an antibiotic may help explain selective pressure and that resistance occurring in that unit. Appropriateness measures how well antimicrobials are being prescribed, where they are good or a bad choice, what percentage were prescribed inappropriately, and do they follow guidelines and indicated for the infection being treated. Why is inappropriate use important? So inappropriate use means treatment which is not in line with the recommendations of the authorities or other local guidelines. It may increase the risk of adverse effects, including the development of AMR, antimicrobial allergy, treatment failure, toxicity, and increased healthcare costs due to the increase in the length of stay in the hospitals. These are the reasons for a prescription being assessed as inappropriate hospital NAPS contributors in 2019. So these reasons include, we have here, the spectrum is too broad, so the prescribed antibiotic is too broad. We have also the incorrect duration, the incorrect dose or frequency, and the spectrum may be too narrow. Concept of the antimicrobial stewardship or the AMS. Antimicrobial management or stewardship programs have been developed in response to the need to reduce unnecessary and inappropriate antimicrobial use. They are part of a broader system for infection prevention and control to minimize resistance. An AMS program alone is not sufficient to control resistance. To be effective, a program needs to be established in conjunction with a comprehensive um, infection prevention and control program that includes hand hygiene, standard and transmission-based precautions, and cleaning and disinfection. Antimicrobial stewardship is taking into account evidence of efficacy, toxicity of the drug, ecological harm, or the effect of resistance or development of the Clostridius difficile infection. Successful antimicrobial stewardship requires executive support and clinical leadership as well as teamwork between prescribers, pharmacists, as well as nurses. Essential elements of antimicrobial stewardship include the use of treatment guide that takes into account microbiological susceptibility patterns, antibiotic formulary. We also have the selective reporting of the susceptibility testing, monitoring and auditing antibiotic usage, reviewing antibiotic prescribing with intervention and feedback to prescribers. Some key components of the antimicrobial stewardship. Now we have the right antimicrobials to be used, right documentation, right duration, right route of administration. Of course, we have to use the right dose, the right time, and the right patient. EMS is a set of coordinated initiatives or activities that together prevent poor prescribing and emergence of resistance. The four pillars of AMS are good governance, restricting antimicrobials to appropriate indications and first-line therapies, auditing, surveillance, and using these to undertake quality improvement initiatives, training and educating the workforce using international government or in-house educational resources, and providing regular workshop and seminars on using antimicrobials wisely. Microbial stewardship is not only practiced in the hospitals, it can also be implemented in the community. For example, we can use not prescribing antibiotics for colds and flu. We also have the delayed prescribing. So if a patient is insistent on receiving antibiotics, offering a script but suggesting that it should not be dispensed unless symptoms worsen or fail to improve after a specified time. We also have the shared decision making. The shared decision making means providing information to patients about each management option and arriving at a shared decision that incorporates and patient values and preferences. We also have the public declarations in the practice about conserving antibiotics. For example, having signs in the waiting room. So for the pharmacies, we can also offer symptomatic support for cold and flu. Antimicrobial stewardship can also be practiced in the home, so not taking antibiotics that haven't been prescribed for you, discarding old antibiotic medicines appropriately. We also have in the industry investing in research and development for antimicrobials. We also have here the antimicrobial stewardship during COVID-19. So COVID-19 has presented many challenges for managing the patients with infections. The key message here is that antibiotics do not prevent or treat COVID-19, but can cause adverse effects, allergic reactions, drug interactions, and increased risk for future resistant infections. The key messages of this presentation: antimicrobial resistance is a worldwide problem that affects human and animal health. The misuse, overuse, and inappropriate use of antimicrobials has contributed and continues to contribute to antimicrobial resistance. So few new antimicrobials are being developed. And antimicrobial stewardship work hand in hand with prevention and control strategies to help address antimicrobial resistance.